This patient presented with infection of an inflatable penile prosthesis, and I have performed an explant of the inflatable penile prosthesis. He had a big scrotal abscess, which I have already drained. As you can see how edematous the scrotum is, I was able to extract the pump through this incision, which I will cut. I have already explanted both cylinders, the cylinders on the left side as well as the cylinder on the right side. I inflate the cylinders in order to render the reservoir free from fluid. So right now it should be easy upon dissection to explant the entire reservoir. As you can see, the reservoir is full of pus and fluid. Can I have a culture swab? I'll be culturing this area. This is the reservoir that has been explanted. These are the cylinders, and this is the pump. So all the tubings have been dissected out. All the connectors have been dissected out. So I like to leave my entire device connected when I do my explant. Once I explant everything, then I remove the device. So can I have some hemostats, please? 3 hemostats. One, 2, 3, straight scissors. Yep. See how I explant the pump. The pump has been explanted. I have one more hemostat, please. And another one. I'll explant this cylinder. One more hemostat. One more hemostat. One more. So everything, all the components, this is the reservoir being explanted. Now all I have are tubings. Now I will match the tubings to find out which tubing match with this one, you see? So I'll be able to remove this tubing, it's free. This tubing matches with this one, you see? So I'll be able to pull on this and then this comes out. I have only one tubing left. It's free, and I remove that, and everything is. So now the patient is prosthetic device free. I explanted everything. In cases where there's an infected penile prosthesis, I prefer to explant all the components of the inflatable penile prosthesis in order to not leave any residual infectious process in the patient. So right now, I will be irrigating profusely the surgical wound. I will be doing some debridement. I'll be placing some drains, and this will be the treatment of this patient. This patient also had an erosion, so there was a perforation when the surgeon had placed the penile implant. Therefore, there's a communication between the corpora on the left and the urethra. This is the reason I have left a urethral Foley catheter in this patient. Hopefully it will heal. If it does not heal, I will come back and do a urethral reconstruction and close the fistulous communication. This is surgical technique by Dr. Angelo Goose.